Good evening and welcome. Today we're hosting this our first of counseling issues and trending topics. We want to explore the topic of euthanasia, a very controversial topic, otherwise known as mercy killing. Now, from the medical perspective, euthanasia is defined as a practice of intentionally ending a life in order to relieve pain and suffering. It is originated from the Greek word eu, which means godly, or thanatos, which means death or the good death. Now, to further explain euthanasia, we have Counselor Allison to expound on the types of euthanasia. Now, Counselor Allison, if you mind, enlighten us of what are the types of euthanasia.
Hi, afternoon. This is a very controversial topic, I must say. There are 4 types. You have active euthanasia, you have passive euthanasia, you have volunteer euthanasia, and you have non-volunteer euthanasia. Now let me expound on them for you. Active euthanasia is where a person deliberately cause a person to die, right, because of something went wrong. While you have passive euthanasia, where in the medical field, the patient was withheld from getting proper medication or the doctor did something wrong. So that is a part of it. Then you have the volunteer, where the person is going through severe trauma, pain, and they want to end their life, and they ask the doctor or the family member to pull the plug. So they want to die, so to speak. Then you have the non-volunteer, where the patient is unable to give consent to a person to do any harm to them, but it was done. So those are the 4 that we're looking at, okay?
Good. It's good that you mentioned that it's voluntary and non-voluntary. But does that make it right? We want to look at if that is ethically right for a doctor to take the life of a patient. Now we want to talk to Counselor Seymour. Is it ethically right or wrong? We want to look at that today. Counselor Seymour, talk to us.
Good evening, everyone. First of all, before I look at the ethical issues surrounding euthanasia, I must speak to some countries which practices euthanasia around the world. First, we're going to look at the Netherlands. It legalized euthanasia April 1st, 2002. Belgium Act went in effect on September 3rd, 2002. Quebec, Canada on June 18, 2016. And the United States law took effect in 1997. And Luxembourg became the 3rd country in Europe after the Netherlands and Belgium to legalize euthanasia. However, there are several ethical issues surrounding the practices of euthanasia, and some of these issues are a duty to die, the principle of double effect, futile care theory and health care rationing, organ donation and harvesting, autonomy, which is the right to refuse treatment, who makes the decision, personhood, cognitive impairment and euthanasia, the disabled and euthanasia, moral relativism, euthanasia and non-terminally ill people. And these issues are coming from disability activists who fear that voluntary euthanasia will soon give way to involuntary or coerced euthanasia. Now I'll turn over back to Councillor McFarlane, who will expound some more on the topic euthanasia.
Thank you, Counselor Seymour. It's very right that you mentioned who makes the decision, because I'm in the middle now as to who really makes this decision to take the life of a patient. there are certain advantages and disadvantages surrounding the topic of euthanasia. And just want to mention a few of them. One of the advantages is that it ends the suffering of the dying. Ending the suffering of the dying, I question it. Is it out of pity for the doctors? Or is it that the doctors see it fitting to just end the lives of their patients? Another advantage is that it gives dignity to the dying person. So the person dying feels as though I'm justified because I was the one who asked for my life to be taken. Whilst we're looking at the advantages, there are also disadvantages. Some of the disadvantages it violates ethics. Councillor Seymour, you mentioned ethics. And it goes against the physician's oath. Now, for every physician practicing, there is an oath that you have to pledge to have the patient's interest held at heart. Now, is it that a violation of the patient? And is it that the doctors are in breach of their oath just by taking their patient's life? Councillor Allison, what do you think about that?
To be clear on that, it is clear that the doctors would have to go against their oath because you're sworn to protect. We understand that you're not God, but you should give the person a right to live. Why should you take someone's life? They have the right to be here. It's a case where there are times when no one wants to end no one's life, but yet a doctor would call to say yes. Is there money involved in doing such thing? Is there ethical in this? Then we can look at it to say no one should take or call the shot to take someone's life. Allow them to live.
Very good point, Councillor Allison. Councillor Seymour, it is my knowledge that there are certain drugs that are administered in order to end the lives of the patients. Now, the drugs that are used include sodium thiopental, which is used for inducing unconsciousness to the patients. Also, you have pancuronium bromide, which is called Pavilon. It causes muscle paralysis and a respiratory arrest. Now, you realize that the patients are slowly dying with these drugs being administered. Now, potassium chloride is the one that is the most serious because this is the one that stops the heart of the patients. So, whilst we are looking at euthanasia, and Councillor Allison and Councillor Seymour, you have brought about some good points, and I think the world is listening to them just now, because these countries that are practicing these are some first world countries, right? So I believe we can conclude on the matter that euthanasia will always remain a topic debated upon by proponents and opponents. The advantages and disadvantages will always be the deciding factors when practicing what we would call mercy killing. No, Councillor Allison, there is something very integral that we want you to point out for us, and that is the difference between active and passive euthanasia. Please, brief us.
Okay, I will speak on that. To be honest, this is like asking what is the moral between killing and dying. You say that. Active euthanasia. This occurs with the medical profession or another person deliberately doing something that causes a patient to die. While on the other hand, passive euthanasia causing when a patient dies because the medical profession either did something wrong or not necessary to save the patient's life. To be honest, there's no difference between them. They're both, to me, is helping the person to commit suicide or homicide. It is murder. So none of the two of them make any difference. Okay? It is a case where you switch off the life supporting machine, discontinue feeding tube, do not care on the life extended in operation, do not give extended drugs. So in other words, you're helping the person to commit suicide. So the person is dying because of your way of how you think the person should go. And to be honest, you're not God. If you look at it in ethical sense of the biblical perspective, you're not God. He's the one who has the final say on a person's life, not a doctor. So a person must have a chance to live.
Very good point. And Councillor Seymour, is there anything that you'd want to add?
Okay, basically, we think about autonomy, which is the right to refuse treatment. The patient have a right to refuse treatment. And at the end of the day, even though some of these patients refuse treatment, the decision still rests with the physician. He is the one, or she is the one, who have the last say in administering this lethal drug to the patient to end their life.
Okay. You've heard the hot topic. So leave a comment, leave a like, and subscribe. Now we want to thank you for your time and for giving us your ears.
You're welcome.
Thank you.